what do you feel like you take back from the experience, if you had to like say one or two or three main things that you take away from it?
On a functional level, I would say I took away my ability to speak Spanish. On a visual level, I would say I got the ability, not physically visually, but sort of emotionally visually, to take my own perspective and try and put it in someone else's shoes, to try and expand my own mind to envision someone else's entire culture instead of my own culture, which is very difficult. Especially before I went there, it's a very difficult thing to do. And another thing I would say is I definitely became a much more social person myself.
Aside from just the, you know, like what you're, what you actually want to do in terms of profession within medicine, if you actually think about healthcare and think about health and think about being part of the workforce in healthcare, did being in a different healthcare system give you any kind of perspective or anything?
Yeah, it definitely gave me a lot of perspective being in that healthcare system, because their healthcare system is so different from our own, but they still consist of teams of people, nurses working with doctors, working with, in some cases, curanderas or natural healers or birthing mothers, things like that. And so to kind of relate that back to here, where I work in the emergency department as a research associate, and so here that's still same functional unit of nurses working with doctors, and so even though the two systems are totally separate, that central core of a team is just as important to each side. And so I see that as very, very important now for me to, when I become an MD or a doctor, to learn to work well with those around me, because it is definitely not a single person thing, it's a team effort all the way through.